Hi guys, my name's Conrad and I've thrown together this little presentation to help you guys get ready for accreditation this year. Their visit is mainly going to focus on infection prevention and control, so hopefully this will get you guys better prepared and more comfortable for their upcoming visit. Some things we're going to go over today will be hand hygiene and the chain of infection. So what does it take to get an infection and how to prevent it and all that. And then also we're going to talk a little bit about infection prevention and control, things like donning and doffing procedures and routine practices. Everything we're going to talk about is aimed towards reducing transmission of microorganisms. So here we go. So the first topic, hand hygiene. A little bit about it. It's the single most effective measure to prevent the spread of infections. In Canada, about 11% of hospital-admitted patients get infections during their stay, and this can all result in increased healthcare costs, disability, and around 8,000 to 12,000 deaths per year in Canada. So hand hygiene is a pretty simple little act that does a lot in preventing the spread of nosocomial infections. Something we all can do and has a big impact. So the chain of infection, what is it? It's a model to understand the process of the infectious disease. Each chain needs to be intact for transmission to occur, and the chain may be broken at any link to prevent transmission. So each of these chains need to be intact in order for someone to get an infection. So we have an infectious agent, a reservoir, portal of exit, means of transmission, portal of entry, and a susceptible host. And if we break this link anywhere in this chain, that will stop the risk, stop the chance of infection. And there's many things we can do to do that. So we're going to talk a little bit about each chain. The first one is the infectious agent. What is it? It's any microbe that can cause disease, and some microbes are able to multiply faster than others, which gives them a greater chance to cause infection. So some are more dangerous than others. Some are faster growing and stuff. One of the most common infections we see in the hospital setting is C. diff, Clostridium difficile. And yeah, we see this a lot. So wash your hands, keep everything, sanitized, and that'll go a long way to help prevent these from getting to our patients and ourselves. So the next chain is the reservoir. It can be any place in which the microorganisms can grow or multiply. It can be, each of us, humans, animals, or even the environment, like a doorknob or something. Or in our unit's case, I think we had issues with sink drains that were developing a biofilm and causing a risk to transmission to patients. So there's lots of things in the environment that can act as a reservoir. Next chain is portal of exit. So it's an exit point for the microorganism to leave the reservoir. So it can also be many things, like if you sneeze, your mucus might, get on some object, and that object might become a vector to get in someone else, or it's just an exit point from the reservoir to get out and into the next victim kind of thing. So the next chain is the means of transmission. It's the way in which organisms travel from one location to another. So it could be, like, for example, dirty hands through contact transmission, or sneezing, like droplet transmission. But yeah, it's means is just how it's being transmitted from one person to another, or one location to another. Next chain is the portal of entry. It can be It's an entry point for the microorganism to use to enter the host's body to grow and colonize and cause infection. So I added some pictures here, like you pick up the organism off of a door handle, and then maybe you don't wash your hands very well, and you miss one of those bacteria, or maybe you don't wash your hands at all, and then you go for lunch and you eat a burger, and that's a portal of entry in your mouth and into your system. Also, maybe the same thing. You grab a door handle, you don't wash your hands very well, or don't at all, and then you have a scratch and you rub your eyes or something, and yeah, these are all portals of entries. Other examples are like IVs, because it's compromising the skin integrity, and also providing a portal directly into the bloodstream of the patient. You have your Foley catheters or open lesions. All of these, like any part, any way the organism can get inside of a person is a portal of entry. So the chain of infection, the next one is the susceptible host. So this is any person with a decreased resistance to acquiring an infection. Like certain populations can be more susceptible than others. For example, the elderly or young like children, premature kids, individuals with comorbidities or disease, or just someone with a diminished nutritional status and immune function. Anyone really that can pick up this bacteria or microorganism that would cause infection would be a susceptible host. The next we're going to talk about, so I think that's all the chains. 1, 2, 3, 4, 5, 6. Yeah, so that was the chain of infection. Next thing we're going to talk about is just a couple different types of transmission. I don't think we're going to talk about all of them, but I'll talk about some the most common ones we see usually in units. So contact transmission. As nurses, we have direct patient contact with multiple people and patients every day. Because of this, healthcare provider hands are the most common means of microbe transmission. Sometimes we, feel rushed in our day and might get complacent and forget to wash our hands, and we might take those bugs to another patient or another nurse, and that other nurse will take it to another patient. So. Or doorknobs. So yeah, this can be seen as direct or indirect contact transmission. Direct contact transmission is from one person directly to another person. And indirect transmission is the use of a vector like a door handle, where you transfer microbes and to an object, and someone else picks up the microbes from that object and transfers it to a patient or themselves. So this is why hand hygiene is so powerful for breaking the chain of infections in its tracks. Like, we use hands for everything. So if we can just really ingrain proper hand hygiene all the time, between every interaction with a patient, and follow the 4 moments. We're going to go over the 4 moments later on in this video, but just be really diligent with your hand hygiene, and that goes a long way. Which you guys all know this. So acceptable methods of hand hygiene. So there's 2 main methods of hand hygiene with AHS. The 2 main acceptable methods are soap and water, one, and then the other one's alcohol-based hand rub, 60 to 90% alcohol. So alcohol-based hand rub is the most preferred method due to its speed. Like, it doesn't take very long to squirt it on, rub it in until it dries. Plus, it has moisturizing emollients. I forget the word, but it has moisturizing additives, which keeps your hands healthy. Whereas soap and water, it does a really good job, but also repeated and very frequent soap and water hand hygiene can dry out the natural oils in your skin and create cracking and pain, and also that would be another portal of entry right there. If your skin cracks and opens up, that's a break in your body's defense mechanism. So a mixture of the two is great, and AHS really pushes alcohol-based hand rub as the preferred method. So the only moments when you shouldn't be using alcohol-based hand rub are when the hands are visibly soiled, when you're caring for someone who's actively vomiting or diarrhea, or before handling food. Those are, kind of like, you really should use soap and water in those scenarios. Everything else you should, try to use alcohol-based hand rub as much as possible. So proper hand hygiene technique, I got a little diagram here of really how to wash your hands. The most common areas of the hand that are neglected are the back of the hand, between the fingers, fingertips, thumbs, and under the rings. Like, a lot of time we're wearing hand jewelry, and like we throw hand sanitizer on it, but it's not really getting underneath the ring. Plus, there could be like diamonds and nooks and crannies where bacteria, can grow, and it's hard to get at. So it's preferably not to wear any hand jewelry, but AHS does say that like plain bands are okay, just because I think there's less corners and divots and like little spaces for bacteria to grow. It's a little bit easier to clean. But remember to clean underneath your hand jewelry if you have it, or preferably don't wear any at all. So in order to sufficiently clean your hands, all areas of the hands must be cleaned. And you guys have all had your hand hygiene labs and all this stuff, but we all are very busy, and it's very important to like stress proper hand hygiene. Rub your fingernails, get around your thumb, rub around your wrist, try to get every spot that you can. And if you are using soap and water, just remember to, if it's got a handle, once you're done drying your hands with a paper towel, use that paper towel to, turn off the sink handle or open a doorknob or something. Because those two objects will be likely the most dirty objects in the bathroom or wherever you're washing your hands. So, if you touch that, it's almost useless that you just washed your hands. So try to use paper towel to open doors and turn off taps. Some barriers to hand hygiene. Gloves can provide a false sense of safety. Sometimes people leave gloves on and proceed to the next patient. This again is probably because, they're feeling rushed, but this is not a good practice. It shouldn't happen. They must be removed in between patients every single time, so you can perform hand hygiene before and after. Gloves should only be worn when you might be exposed to blood or body fluids, when providing care to patients on extra precautionary measures, or when performing invasive or sterile procedures. Even when gloves are permitted, hand hygiene must be performed before putting gloves on and after taking them off. Hand hygiene, it's very important. Some more barriers. Never apply hand sanitizers to the top of gloves, as this can compromise the glove material. It's better to just take your gloves off. Don't worry about the cost. Take your gloves off, perform more hand hygiene, and put a new pair of gloves on if you need. Again, hand jewelry is a barrier to performing hand hygiene. And again, I talked about this. Rings are a perfect location for bacterial colonization, as well as pose a threat to glove integrity. So if you put a glove over top of a ring that's got a nice giant diamond on it or little sharp edges, that there's a risk that it'll rip the glove and compromise your PPE, and you'll be exposed to nastiness in whatever task you're doing. So remove those hand jewelry if you can. Another barrier is artificial nails, nail enhancements, or even chipped nail polish. It can all collect and harbor microorganisms. I remember one of my lab instructors was super stringent on fake nails and nail extensions and how gross it was, because there wasn't really any great way to clean underneath there, and they harbor bugs, and it's pretty nasty. So AHS really pushes to, keep your nails short, don't have nail extensions, and try not to have chipped nail polish. If you do put nail polish on, just if it starts chipping, just remove it all and put more nail polish on, and just try to not to have little crevices and stuff where things can build up and they're hard to clean, if that makes sense. So yeah, both hand jewelry and nail accessories are proven to be associated with nosocomial infections. It's proof. There's proof out there. Some more barriers. Some people experience skin irritation from hand hygiene. This is most commonly associated from frequent washing with soap and water, which we mentioned earlier. It'll really dry out your skin, get rid of all the natural oils, and compromise the skin integrity. Weather can also increase skin irritation. Edmonton, where it's a very dry and cold climate, especially like in the winter time, and that can cause a lot of issues with our skins, because dry, cold weather can make people more sensitive to irritation. So to fight this, you can, when you're outside, try to wear mittens while outside and use hand moisturizer. Even in the summertime, just use hand moisturizer all the time. Like, we wash our hands so much that it'll help a lot to keep our skin healthy. And the mittens will just, keep your hands, moist. I guess that's kind of gross, but it'll fight the dryness during the winter. And alcohol-based hand rub, I mentioned this before, it contains emollients, I don't know how to say it, emollients, that can help fight dryness. And this is just a review of the last couple slides. AHS tries to promote alcohol-based hand rubs because of this. And also, adequate hydration. It's always underestimated. And, we're very busy. Try to drink as much water as you can throughout the day. I know sometimes it feels like you don't have enough time, but just hydration is important with skin health as well, and overall health. Water's good. Drink some water. All right, so here's the 4 moments I was talking about. This is a good review. Pretty much wash your hands all the time. But these are the 4 moments where it's really important, and where it really is the most effective at breaking that chain of infection. So as AHS employees, we must comply to the 4 moments of hand hygiene as it's AHS policy. This is actually part of our job. We have to follow this. And these moments were discovered to be the times at which transmission of microorganisms is at the highest risk. And proper hand hygiene will protect both you and your patient and others around you. So what exactly are the 4 moments? You see here, number 1, before contact with the patient or the patient's environment. So before you enter the room and interact. Before clean or aseptic procedure. Before body fluid exposure risk. And also after contact with the patient or patient's environment. So really ingrain these in your head and be really competent with your hand hygiene and when to do it. And honestly, if we're good with this, we're gonna crush the accreditation visit, I think. They'll be very aware of everyone's hand hygiene and how awesome you guys are doing. All right, so infection prevention and control. This is an AHS standardized mission to tackle infection prevention in the healthcare environment, both for patients and staff. It's a joint effort by all to achieve and maintain a safe and healthy environment for everybody. So it's just the battle against nosocomial infections. So some things we can do to help fight this. Some tools we have are personal protective equipment, or PPE. They're used to protect ourselves when performing tasks that put you at risk and have to choose the correct PPE. So you have to choose the correct PPE for the situation. You have to understand what task you're doing and what PPE is needed for that individual situation, and if the patient's on any precautionary measures. So the type of PPE you wear depends on if your patient is placed on any precautions and on their point of care risk assessment. So the point of care risk assessment is just a quick breakdown. It's a quick flow chart of just what you should be doing before interacting with any patient. So we can go over this. Before prior contact with every patient, before you do a task with this patient, you should ask yourself these questions. Will my hands be exposed to blood and body fluid or contaminated items? If yes, you should wear gloves. Will my clothing or skin become soiled from splashes or sprays or contact with items contaminated with blood and body fluid? If yes, wear a gown. And will my eyes or face or mucous membranes be splashed or sprayed with blood or body fluid, or within 2 meters of a coughing or vomiting patient? If yes, you should wear a face mask. And this goes in conjunction with their additional precautions, like if they're airborne precautions, you need to make sure you wear your N95, and this goes hand in alongside the additional precautions, and also hand hygiene before and after. So for our PPE, donning and doffing, there's different techniques for each type of PPE we put on. Their AHS has made awesome review videos on exactly how to properly don and doff your PPE. So donning is just making sure to use the proper techniques so they protect you like they're designed to. Improper use of PPE can put you more at risk of acquiring a microorganism for transmission. Like you see right now, a lot of people are wearing their surgical masks, over their mouth, but their nose is completely exposed. Like, it's kind of useless. So yeah, use your PPE properly. Doffing, when you're removing your PPE, make sure to do so in the correct order from the dirtiest to cleanest. And also be aware, I think this is one of the most common things that's kind of done wrong, especially with masks, and I'm bad for this too, removing masks. I think it's really common to actually, when you remove a mask like an N95, the mask portion is actually dirty on the outside, so you really don't want to touch that with your hand, because that's what was catching all the nastiness. So yeah, just review your donning and doffing techniques. You want to take the bands off and lift it away from your face without touching the mask. So and every piece of PPE has their own technique for removing, so it's very important to review that. So PPE breaches, we talked a little bit about it before with the rings and with the giant 10-carat diamonds ripping through the fingers. PPE breaches can happen when damage occurs to the PPE and puts your skin or mucous membranes at risk of contact with the environment. They're supposed to protect you from blood and body fluids. Breaches are also considered workplace incidents, and because of this, a workplace health and safety report must be filled out and submitted. A breach can also be like a needle prick injury. You're, maybe just got done giving someone, a shot of something, and maybe you slip and you poke yourself with the needle. Hopefully that doesn't happen, but it does happen sometimes, so be very, very careful. And they're workplace incidents. So, PPE. What do I do in the event of a breach? First of all, you stop. If, let's say, a finger prick injury, you stop, or when it's safe to stop. Like if you can't stop in that moment, stop as soon as possible. You remove yourself from the patient care environment, outside the room or wherever. You properly doff your PPE, and if your clothing's contaminated as well, it should also be removed. So let's say you have a gown and those plastic gowns and they rip and you got a bunch of blood all over you. You should remove your personal clothing as well. If you have wounds, let it bleed and then clean the affected area. Rinse mucous membranes if splashed. Notify your supervisor about the when, who, and what happened. Also, what controls were in place, what kind of PPE. You have to notify your supervisor about the situation, and then you need to fill out a workplace health and safety report, as well as a reporting and learning system if the incident involved the patient. That's that. So routine practices is next. There is a bunch of extra routine practices that AHS has put in place for us to follow, that also helps fight infection, and promotes infection prevention and control. So some of these are a new needle and new syringe every single time. Do not double dip. Don't use the same needle twice. Don't use the same syringe twice. Needles and syringes are meant to be single use, so they should be properly discarded after every use. Don't stress out about the cost. It's what they're meant to be single use, and the unit accounts for this. Always scrub the hub. So this means a vigorous scrubbing with an alcohol or chlorhexidine wipe for at least 15 seconds on all stoppers and injection ports before introduction of the needle. This prevents contamination, and these ports can be, like an IV hub, can be a portal of entry for the patient, right? So that is breaking the chain right here, which is important. Some more routine practices. Respiratory courtesy. Now more than ever, we're seeing this. You need to be more aware of your respiratory courtesy. So if you're feeling under the weather, just especially now, don't come to work and expose the patients to your bugs. Stay home and heal up. If you need a cough or sneeze, ensure your nose and mouth is covered. Right now, we're all wearing masks all the time, but whatever. If you're at home and around family or whatever and you don't have a mask, use the dabbing technique. Betty White's demonstrating this up in the corner. Sneeze into your elbow, or have a mask. If you have a mask on, just sneeze in your mask, and then replace it if it's soiled. But if you don't, use a tissue as well. But always remember to perform hand hygiene after these events. So do the dab, sneeze in your elbow if you don't have a mask on. Routine practices. Environment and equipment cleaning. This is always an area that everyone can improve. Surfaces and equipment can become contaminated everywhere healthcare is provided, and continuous and meticulous cleaning should be performed to fight transmission of microorganisms. Clean all the time, all over your workspace. Just maintain a clean, sterile, and not sterile, but just sanitize all the time, regularly, especially high-use items like glucometers. Clean those in between every patient. Just continuous cleaning. If the area is visibly soiled, you must first wipe the surface until it's visibly clean. Then you must clean again with an AHS-approved cleaning solution to disinfect and kill the microorganisms. Clean in one direction, from cleanest to dirtiest, is always a good rule. And don't share personal care items between patients, like lotion or razors or soap. Those personal care items should stay at the bedside and only be used on those patients. If another patient doesn't have it at the bedside, don't use the patient beside them. Go open a brand new one and leave it in the room for them. All right. Thanks for listening to my rant. It was awesome. Hopefully you didn't fall asleep during this. And here's some references that I got from AHS. I hope you all have a wonderful day and continue performing diligent hand hygiene. Okay, goodbye. Thanks.